everyone, and welcome back to PHAMCAST. We are continuing our conversation here with Dr. Hannah, endocrinologist and founder of Healthspan Digital. I love this conversation because it really starts to really break the conversation open about the possibilities of what's out there and the future of medicine and the future of health for everyday people. Let's talk a little bit as we finish that first segment about, those people, the average person that's embracing some of these complementary therapies or technologies that maybe don't have a lot of evidence behind it yet. And they're being met with a lot of negativity or, it's not, that doesn't work, or from their physician. What do we say to people that are using some of these technologies that are actually seeing a difference in their health?
Yeah, I see that a lot. Even within the traditional healthcare system, using off-label drugs can be frowned upon. Now, sure, what do we tell the individual that underwent a proactive full-body MRI for proactive health management and found an early-stage tumor and is currently cured or in remission? So I don't think we need to discount the possibility of a lot of these proactive consumer-focused products because they may show evidence down the road that they may play such an important role in early disease diagnosis and prevention. It's just that we don't have a lot of evidence in a lot of these products and services. And Mark, there are bad actors in the traditional healthcare models and in the non-traditional healthcare models, right?
Indeed.
So perhaps in the non-traditional healthcare model, there's less regulation, and consumers are more perhaps prone to manipulation, right? And fraud. So I think at the end of the day, we as healthcare providers have an important responsibility to educating ourselves about what's out there and to providing a guide to what consumers and our patients might have in terms of questions, and we need to be that bridge. So I'm excited about creating technological bridges and connecting someone's home environment to the traditional healthcare system through AI-powered tools, client-facing apps that can create personalized insights through ingestion of data from their wearables and day-to-day behaviors. And I think that we can influence someone's health trajectory through behavior changing.
Indeed. This excites me on so many levels because I do see, the average person being open to the possibilities of that. Not everybody's going to have access either financially or otherwise to some of these bigger things, these scans, for example. But as an endocrinologist, there are so many ways you can educate your patients through behavior and lifestyle choices. Let's talk a little bit about that right now. If someone's sitting at home listening to this podcast or watching us on TV right now, how can they get into action? How are you going to help stock their toolbox, their preventative health toolbox, so they can improve their health esteem and feel like they're part of this healthcare team that you and I are both part of?
Right. Well, let's talk about healthy longevity practices.
Yes.
And let's start with sleep.
Yes.
We spend a third of our lifespan, which is the number of years that we breathe oxygen from birth to death, in sleep. Don't you want to live a third of your life in good quality sleep?
Yes, indeed.
So try to achieve good quality sleep. And you can do that through various ways, including setting an alarm to go to bed. Don't eat a few hours before bedtime. Don't look at your phone.
Yes.
Or use other distractions before bedtime. And try to regulate your sleep-wake cycle. Have it as an important, consistent tool. And that by itself will create such important physiological changes, will lower your risk for cardiovascular disease and chronic diseases. It will help take toxins away from your brain and body. It will help regulate your memory and make you feel good.
Absolutely.
The next day. So don't discount the impact of sleep on your overall health.
I'm so glad you're bringing this up. During my undergrad, I worked at St. Mike's and had the privilege of working with Dr. Victor Hofstein in the pulmonary function and sleep lab, and learned a lot about the importance of sleep and the impact it has on people's overall health. And we take it for granted, and we are often sleep deprived, and it will almost wear it, I think, certainly in the North American culture, like a bit of a badge of honor. That restorative sleep cycle that we deprive ourselves of really has a massive impact. And I think we're seeing that a lot in the younger generation too, with devices and things. So thank you for bringing that up. And people always think, well, it's so simple, it can't really have that much of an impact. It has a massive impact.
Massive impact. It's cheap.
It's
right?
accessible.
Yeah,
absolutely.
It's not the $20,000 longevity assessment that you need for optimal health, right? It's something that is very doable.
Yes.
And if you can't do it, use something that will enhance it, such as magnesium, L-threonate. Most of us are deficient in magnesium. Use 400 to 500 milligrams of elemental magnesium, L-threonate in particular, because magnesium comes in different forms
Yes.
Before bedtime. Use melatonin. I mean, these are relatively safe supplements that can help with sleep. Choose the right temperature in bed and avoid any distractions and food and caffeinated products before bedtime.
Yes, and we had Dr. Carolyn Teskey, a good friend and behavioral optometrist, and talking about blue light, like you just said. I don't think we realize in this technological world that we're living in and constantly with our eyes on screens, what that's doing to our circadian rhythm and our brain and many other things. So you're absolutely right. Some of those things are so, so important. What else? What else is in our toolbox that the average person can do to improve longevity?
My favorite, the organ of longevity, is muscle.
Yes.
Build your muscle.
Yes.
And start young. You need to build muscle. You need to be fit throughout your lifespan.
Yes.
There's no excuse. You've got to go out there every day. You've got to move. You've got to improve your endurance and your resistance. And that will in turn create a healthier immunity, lowers your all-cause mortality, lowers your development for chronic disease, helps you feel young, look young, and consider your muscle as your longevity engine. And you need to feed it with the right raw material, the nutrients, and the right exercise. And if you get an opportunity to measure how fit you are through a test called the VO2 max test, which is how efficient you use oxygen during exercise, you need to understand what your baseline is and devise an exercise plan that will help enhance and improve your VO2 max score. A higher score is associated with a fitter you that will live a longer, healthier life.
You're speaking my language. I mean, a background in kinesiology, VO2 max, that's certainly what we did. And as a registered and proud registered massage therapist, muscle is my passion, and I see how people take it for granted. I see the catastrophic results of not taking care of the musculoskeletal system. And when we talk about muscle and prevention, I mean, you talked about immunity, cardiovascular health. When we talk about even falls and fracture prevention, as an endocrinologist, I mean, you certainly know the role that things like osteoporosis can play, and that muscle is critically important for falls and fracture prevention. And so I love that you're saying that, because everyone can do this. Everyone can build their muscle easily. Weighted vests, going for a walk, resistance bands, and at every age and stage, correct, Dr. Hannah?
It's never late to start, and never late to double down on muscle strength and conditioning.
Yes.
And you don't have to train as an athlete, right?
Exactly.
Just get your steps. A minimum of 4,000 steps a day can lower all-cause mortality and cardiovascular disease. Also, what's shocking is by the age of 70, women tend to lose 50% of power. Men lose 30% of power. Losing power, losing fitness, losing muscle, sarcopenia.
Yes,
right?
Indeed.
Will increase our risk for falls, hip fractures, development of disease, and frailty.
Absolutely.
Right? Do you want to be a frail 80-year-old or a healthy 80-year-old that's going to start a new business and feel young?
And have fun with their grandchildren. That functional fitness, when we can stop thinking about using our musculoskeletal system as exercise, but rather as a key to function. and the ability to move. If we don't move, we can't move. And when we move and have the ability to have quality of life, it's so rewarding. And in the work that I do with seniors, this is what fuels my heart when we're able to, whether they're on my table or we're plugging them into exercise programs and getting them and talking about the nutrition to fuel their muscles, to see the difference in that human being's ability to interact in their day-to-day life. And like you said, be vital at 80 and 90. It's never too late. And I want everyone listening at home to recognize that. Oh, I'm too old for that. No, you are not. Start slow, but pay attention. Oh, I love this.
Yes. And Mark, you don't want, the goal is not longevity.
No.
The goal is health span.
Correct.
Right? Which is living healthy
well
for a longer time.
Yes.
And even if that includes, dying from a natural cause at a young age, as long as you lived a fulfilling, vital, healthy life, you don't want to die from disability. You don't want to die from chronic disease.
Correct.
And we can change the course of chronic disease
Indeed.
through proactive, preemptive,
yes,
personalized healthcare management, and all the way to building muscle, sleeping well, eating well, and avoiding the development of chronic disease.
Absolutely. And I love that you're saying, living well. If you look at some of the studies, and you probably could quote one off the top of your head, in North America, people may be living longer, but those last 10 years for a lot of people due to chronic disease, are they living? No, they're living with chronic disease. Their families are impacted. Our society is impacted. And this is what fires me up about investment in preventative measures and helping everyday people to recognize early on, and this starts with our kids, and we have to show them the way, how what we're doing now is going to impact what we can do or can't do later. And you're right. I want to take my last breath, whether it's when I'm hopefully 90 or 100, but I want to live well during that time. And it's attainable, but we've got to change the way we look at our approach, and that's important.
Absolutely.
Oh my goodness, we could talk so much more about the stocking the toolbox. What I'd like to do is take a break here in a minute. We're going to come back, and I want to talk about, this is really intriguing to me. And many years ago, I had someone on a previous podcast I did talking about real estate and things in the home to help seniors living on their own and keeping them safe, technology in the home, and how do we build healthier communities and real estate so that we can have people living longer but living well. Stay tuned, because we're going to be right back with Dr. Hannah and continuing this incredible conversation about preventative health and longevity in a second.